we're also starting to expand our educational sources, and we're starting to educate physicians. And we'll be having our first primary care symposium in November, providing updates for the physicians. We've had a lot of nursing research activities going on, and they've been recognized on a national basis. Sue Dunson and Jean Ellsworth both had a poster presentation at their national meeting of the Oncology Nursing Society this year. And then we have an ongoing study, if you might hear about it, that we have breast myths that are being perpetuated through the teenage years. And we're doing a study kind of looking at what are the myths that teenage girls have, and then providing them with education on what are these myths. And some of the myths are like antiperspirant causes breast cancer. And when I talked with a group of high school students, I was amazed about how pervasive that was. Even after I told them it wasn't, they kept asking me again and again. So either they didn't listen to me, or it's really a myth that's out there. So we're working on trying to dispel myths in our use. And as part of that with our use, as our progress, we're actually going to focus our mother-daughter tea this year on our use. And we are going to be blessed with having the Olympic gymnast, Carrie Stroud, be our guest speaker in October. And we, the ticket to get in is to have an 8 to 18-year-old with you. And because we really want to work on educating the importance of being healthy, how that contributes to breast health, and dispelling these myths at an early age. Community outreach, we're still doing a lot with the funds that you help us raise. We have are continuing our WISH program, Women into Saving Their Healths. We try to have 3 programs a year. We're reaching out with free mammograms we're trying to get to over 100 women a year if we can. And we also have a HOPE program, and there is a grant from the Breast Cancer Foundation that helps with that, but they only pay for the mammograms. They don't pay for an exam by a physician, and they don't pay for ultrasounds if indicated. So the funds that we are earning here help to supplement and pay for those through our HOPE program with it. And the last thing I'd like to update on is just a little bit about mammography. When we look at our volume, we're doing very well. Our diagnostic mammogram volume increased almost 4%, where we did 6,500 diagnostic mammograms. But our screening mammograms have decreased for about the 3rd year in a row. And if you take the small percentages, we're about a 5% increase. And some people may say this has to do with the economy. Some people may say it has to do with bad press. And I really think some harm was done. But when, in November of last year, when the U.S. Preventive Task Force came out with its guidelines. And I think what's important for people to understand is that entity, the U.S. Preventive Task Force, is an entity of, quote, experts, but they're not experts in the field. They are supposed to be unbiased and reviewed scientific literature for the basis of its scientific basis. But they are not people who take care of the disease day in and day out. And they've also now been politicized, because this is the entity that our Congress has given the authority to decide what will be paid for and what will not. Because the new healthcare bill pays for anything that the U.S. Preventive Task Force will classify as a Category A and B preventive study. Anything that is a C or below will not be paid for by the government, and will not be paid, and doesn't have to be paid for by the other insurance companies. Mammography was classified as a Category C in November of 2009. Well, there was quite an uproar, and multiple medical societies said, no, that's wrong. And so there were 3 senators, Senator Olympia Snowe, Kathleen McCulkey, and David Vitter, who added 2 amendments to the Senate bill that was passed on Christmas Eve and is now part of the official health care bill. And so, and they say this, they basically in those amendments said, well, that'll last for the U.S. Preventive Task Force, except for mammograms. And so mammograms will be covered. But those are the things we have to watch with the changes in healthcare. But the whole bad press that went on, saying that women under 50 didn't need mammograms and women over 50 only need them every other year, I'm afraid that if the economy is tough, women are going to think, oh, I only need it every other year, or I really don't need it till I'm 50, so I'm going to save a few bucks this year and not get that. And that's what worries me, and that we're always to see. So when you talk with your friends, you talk with your neighbors, and you happen to talk about this event, I would really love it if you can encourage women to still get their mammograms on an annual basis after the age of 40. That is still the recommendation. That is what saves lives. Okay, I can just take a breath there. I could get really emotional. All right, and now I have the pleasure of introducing to you a loving mother, a supportive wife, and a beautiful wife at that too, and a wonderful friend to all her friends, and just a very wonderful person who just happens to be a breast cancer survivor. But I'd like to introduce you to Jennifer Skinner. Oh, I guess the silent... 4 minutes and the silent auction is closing, so anyone who wants to check their bids and see if they need to just up it a little bit so they can take it home, you can sort over that way. Oh, that's
Good afternoon. Before I start, I'd like to thank my husband and my 3 daughters for coming today to support me. This is really the first time I've ever spoken, especially to this big of a crowd. I speak to a MOPS group, a mothers of preschooler group at church, but it's not nearly this big. So I hope you'll bear with me if I'm a little tongue-tied. So, as Dr. Pratt said, my name is Jennifer Skinner, and I'm really here just to tell you about my journey through breast cancer. It began in January of 2003. And I had turned 40 the previous September, so I fall into the category, the exact category that Dr. Pratt had just spoken about. And my gynecologist gave me an order to get a mammogram, and oddly enough, she had given me one the year before because she thought that she had felt something near my sternum, and it turned out to be nothing. So when she handed me this one, I kind of question, why should I do this if I just had one last year? And she said, well, it's a 40-year-old baseline mammogram, and I was 40. I had no family history of breast cancer. I was not postmenopausal, so it really didn't fit the profile for having breast cancer. But I did choose to follow that order, and I'm really glad that I made that choice. Plus, I really wasn't old enough, unless you ask my kids, which they probably would have said I was old. So, I decided to follow up. I went for my mammogram at the Mole Center.